Good afternoon, gente. My name is Elian Ramos. Welcome to this week's Hangout. As you probably heard, June is Men's Health Month, a nationwide celebration with the goal to raise awareness to preventable health problems in men and boys. According to statistics, men and boys in underserved communities, including Latinos, African American, LGBTQ males, are among the most overlooked populations in this region. They also receive poorer quality care, they face the biggest barriers to care, and they also experience the poorest health outcomes compared with the general population. And so their needs and issues must be recognized so that they can be addressed properly. And this is the reason we're holding this hangout today. We're going to be discussing what can be done about this issue, how we can encourage open discussion about health among men in our communities, and what health resources are available to help our men and boys remain healthy. I have with me some experts who are going to be discussing this. First up is Jose Plaza, who is the National Director of Latino Engagement at Enroll America. Welcome, Jose. And we also have, Jose, you are on mute. We also have Fernando Mercado Violant, who is the Community Educator at Legal Aid Justice Center. How are you, Fernando? Welcome to the show. And we also have Ramon Paolo Lamas, who is the Director of the North Carolina chapter of Men's Health Network. He's also a blogger based in Durham, North Carolina. Welcome. How are you, Ramon?
Great. How are you? Thanks for having me.
Very good. I'm very good. So let's start talking about a little bit what your organizations are doing in the field of healthcare to support men. Any one of you can start. Let's start with you, Ramon.
All right. Men's Health Network is a health education, health advocacy nonprofit organization. We're based in Washington, D.C. and have affiliates all over the nation. We give the health education. There's a community outreach piece, and like I said, there's the policy piece. So we've been trying to advocate for an Office of Men's Health in the federal government, similar to the Office of Women's Health that has been around for about 20 years now, just to coordinate efforts and share best practices and really make use of what people are already doing. So that's just a little snapshot of what we're doing at Men's Health Network.
That's great. And Jose?
Yes, so my name is Jose, and I'm the Director of Latino Engagement with Enroll America, and I work closely with Elian and the Latino Coalition here in D.C. We work closely to let folks know about the benefits of the ACA and really what the Affordable Care Act means, not only to men, but also to Latinos, and the benefits that we have to gain as one of the largest minorities that has gained benefits from the ACA. But also this month, as we celebrate Men's Health Month, we want to be sure that men, as well as Latinos, recognize that this law actually is in place to give a lot of benefits to those folks out there, not just women, but young Latinos and older Latinos as well. So thank you for having me, and I look forward to this conversation.
Thank you for being here. And Fernando? We cannot hear Fernando. Can you hear us? Try without the headphones, Fernando. I think we'll go back to Fernando. But let's start the discussion then. How does race and age impact the health of minority men? And do you have any statistics to share? And either one of you can start.
Well, I can jump on. So in terms of race and ethnicity, the ACA has brought, as I mentioned, numerous benefits to men. Men disproportionately are more uninsured than women. Women tend to be more educated and more connected when it comes to the benefits of the ACA, but also tend to be the leading role in the family when it comes to health insurance awareness, but also issues around healthcare. And so men, really, especially men of color, tend to be disproportionately uninsured and suffer from various health equity issues. And so my perspective in this Google Hangout is talk about how the ACA has brought about actually decreasing the number of uninsured within men. Latino young men have seen one of the highest drops in uninsurance rates thanks to the ACA. And so we saw a drop of about 10% alone within the Latino community in the last couple of years that the ACA has been in place. And today, with the victory over in the Supreme Court case, we hope that more than the 10.2 million Americans that have gained coverage will be able to now expand those numbers and work with states, both federal and state-based, to get information to young men, as well as traditionally aged men that are in need of this coverage.
Yeah, great victory there today. Jose, I know how much Nicole has been working as well as other organizations advocating for the ACA, and so we're very happy that the Supreme Court decided to uphold the subsidies today. So great victory for all. Let's talk about, Jose, you touched on something very important, which is the fact that Latinos are the most underserved in the community. But there's a lot of reasons. I think for one, we tend not to talk about it, not to talk about health in general, especially among men. So what are some of the barriers that you have seen, all of you, out there in your work in terms of access to healthcare by men in particular?
So I can tell you from a cultural perspective, there's certain barriers. There's that tradition of not necessarily needing to go to the doctor. As I said, women tend to be sometimes a matriarch of the home, and they hold information around health and health insurance. And so for men, it isn't necessarily a perspective or a priority that they hold in the household. We've noticed time after time with surveys that women will actually forego medical services for the rest of the family, but men just are that much more disconnected. But when we talk about barriers, men in general tend to be more disconnected from technology. There's language issues. There's also access issues in terms of educational materials for health information. And we've seen these last 2 years that men can go up to a decade without ever having gone to the doctor. And they only go to the doctor when it's time to go to an emergency room. So there's are preventing Latinos and men of color from seeking health. But I think a month like this is very important to let them know that opportunities are available for them. And now with the ACA and its expansion, we're able to provide them resources in their community.
Mm-hmm. You guys want to add anything else to that?
Yeah, I'd like to actually speak on just men in general. As men, I think we're less likely to see a doctor because of the stereotype that transcends all cultures, is being masculine and being the man and being macho and really taking care of everything but themselves. And I think that's an issue for men of color and just white males in general. When I guess to address your question earlier on your the health aspect and the barriers, I actually had some stats earlier that I looked at CDC. Hispanic Latino populations in 2010, the estimated rate of new HIV infections per 100,000 people. You had blacks at 103.6 per 100,000, and then you had Hispanics at 45.5, and then whites coming in at 15.1. So compared to, if we're talking about men of color, the black and Hispanics definitely, in terms of HIV and AIDS, new infections every year, it's definitely a problem that we need to address. And I'm glad that we're having these conversations in terms of community engagement. The ACA definitely brings in a great piece where you have the health care necessary. You have the health insurance so that they have access to health care. But the underlying issue here is health a priority for these populations? Um, like I said earlier, Men's Health Network, we've been doing this work in communities, and it's across the board. I mean, if you just look at the life expectancy, it's at least 5 years across all races. It's not just a black issue. It's not just an Asian issue. It's not an Hispanic issue. It's an issue for all men in general, and the Hispanic Latino population is growing, and so this definitely needs to be on the radar in terms of how we can engage them in a way that they would be accepting towards, like knowing that they have these personality issues, knowing that not personality issues, sorry, but personality, just aspects of the personality that need to be tailored, and it can't be a one-size-fits-all for the whole population. It has to be tailored communications towards Hispanic men, tailored communications towards black men, tailored for white men. And technology these days, we can definitely we have a bigger platform. So apps, websites, there's definitely a good opportunity there. It's just how do we coordinate all these efforts to actually make progress on the overall.
Mm-hmm. And Fernando, do you want to try speaking now to see if it's working? Yeah, it's still having issues hearing you. But okay, so let's continue moving on, and hopefully Fernando can join us at some point in the conversation. There seems to be, in what Jose was saying and what you were saying, Ramon, is in terms of the fact that men in general don't like to talk about health. And so what can be done to encourage men to disclose their health? I mean, to make it part of what we do is something that they seem to be withholding. What are some of the things that you think can be done to fix that?
So one of the things that we've noticed, really, again, and I keep on harping on this subject of women, men tend to listen to women, be it if it's their mother, their girlfriend, their sister. Women tend to dominate the conversation around health. And so it's important when reaching out to men, be it from a health perspective or from even a social justice perspective, because a lot of the work around health does tend to deal with social justice, and really providing them with the rights and services that they need. The best way to reach men is to go through trusted sources. So working with elected officials, working with their faith leaders, working through their employer. We've noticed a lot. Men tend to gravitate towards sources that are trusted and worthy of attention. And so working with those trusted validators in the community to get them to listen to them is one of the important ways to start talking about health. Also, the word of mouth is critical in getting stories out to men. So finding men that have made use of services around health, mental health services, is setting the example within the community is also a big piece. And outreach is difficult when working with men because, as Ramon was mentioning, it's not part of that cultural fabric for men to take the lead in this conversation sometimes. But letting them know and giving them real world examples of how this implicates themselves and their family is also important. And then just the cost of healthcare is also a big factor that men tend to respond to.
Do you want to add anything to that, Ramon?
We've definitely had success, to speak to Jose's point, leveraging the women's voice. That the family piece is very important. And what we find when we go to these community outreach events is that the women are dragging the men kicking and screaming into these events to get screened, and it's a big awareness thing. And to Jose's point, you definitely have to target key influential community leaders that are trusted that can set a leadership example. So, faith-based is a huge, channel, and something that we have to leverage a little bit more. Also, some hopefully we can catch some bigger names, like some like actors, or just bigger names to get the word out there, and then having them as role models in the future.
So the involvement of women. You hear it, women. You have to make your men go to the doctor. You have to make your men, seek health care. So let's go back to Jose mentioned before about the Affordable Care Act. Jose, can you explain a little bit what are some of the benefits that are available now for men under the Health Care Act? Jose, can you hear me?
Sure. So there's several benefits, I think, to the general population, but specifically communities of color and men. Preventative services, it's a huge piece. We know that within our communities, diabetes, heart disease, cholesterol, obesity, those are all issues that are impacting our community. Under the Affordable Care Act now, these are all preventative services that are provided to them free of cost. Different cares around pharmacy and prescription. That is also now being moderated within the affordable and quality medicine as well as care. In states where Medicare and Medicaid has been expanded, folks now that might have fallen under a certain income bracket now have access to it. And then also for young men that are under the age of 26, they can stay under their parents' coverage, which really for communities of color, that is a huge gain because now millions of young Americans are able to maintain coverage to their parents' insurance. So there's a couple different benefits that men have to gain, and really are part of these 16 million Americans that have gained coverage under the ACA.
So in the larger scheme of things, what can be done to close the gap in some of these health disparities in men? We know that the Affordable Care Act is helping in that, but at the, let's say at the institutional level, what can be done to help close this gap in disparities? Ramon, you want to talk about that a little bit?
I think that's a huge, complex issue. You're dealing with the social determinants of health, so you're dealing with the employment issue, you're dealing with transportation issue, you're dealing with housing, you're dealing with, just a large education. All those tie in, and once, I guess leadership up in Washington, once they start creating policies that include all these other social determinants, and kind of coordinating that in a better fashion, then you can start seeing disparities being reduced. I think it's going to take a long time. I mean, it's a, this is all where we are right now is from all the policies that have already happened. So new policies would take a lot of work and a lot of time. But an example of a city doing this is Richmond, Virginia. They do their local city government just passed a health in all policies. So any new policy that's being proposed, they have to consider the health ramifications from it, whether or not it's good or bad, in terms of like how it affects overall health for their citizens. And which is a great step forward, and I think that's a great model that we can start looking at for legislators up in Washington, representing the nation as a whole.
Martha, you want to add anything?
But also, yeah. So I think, as we mentioned earlier, this is a cultural piece. I think of having access to healthcare and have it being part of our daily life to have health insurance. So I think. Just as we saw decades ago with Social Security and Medicare for our seniors, we're only in our 5th year of the ACA, and we're really only in our 3rd open enrollment cycle coming up at the end of this year. So it's something that, it's starting to become part of the conversation as we work with our communities of color to let them know that coverage is available and that financial help is here for them. I think in years to come, we will see a lot of these health disparities being addressed by preventative services that the ACA offers. And it's not going to be an issue of, men versus women. Women had much to gain from the ACA, but I think now it's important for men to also start recognizing some of those benefits.
Awesome.
Can you guys hear me now?
Yes. We now have.
Okay. I had to run and get another laptop because I don't know what was going on with mine. But
you know what it's like. We're slaves to technology. But
yeah.
So we're talking about, Fernando. Maybe you can just share a little bit here. About what are some of the things that can be done to close the gap in disparities for men in the served community. And so, Ramon and Jose already gave their just. Your turn.
I'm very happy I came back to life for this question. I work at the Legal Aid Justice Center, and we're based in Virginia. Virginia is one of those states that haven't expanded Medicaid. It's also one of those states that have very strict entitlement restraints on immigrants. So what we have is a lot of the people that we serve, we work with in the community, especially in Northern Virginia, is that even though we are, my job is to help increment enrollment in the ACA, a lot of it is in what can be, because a lot of those folks aren't eligible for those, aren't eligible for Medicaid. So what are the other options? And it's difficult to see that because a lot of free clinics have enormous waiting lines. Some of them have to go to an RV that is admits in the parking lot every Thursday. That's a waiting line. I mean, there's very, very small access to care. And in order to close that, what we need to do is expand Medicaid. I mean, that's the most important thing. And for the people that are in this gap, I think it's important for them to understand why they are there. There's a potential component to that, because instead of thinking that victimized by the system that they're in, feel empowered and civically involved in that they elect, have their interests in mind and that's kind of what we're working on here in Virginia, and that's what a lot of other states are having. It's just going to really take a lot of educational outreach and a lot of changing hearts and minds of those that aren't personally affected by not being insured to understand that there are still tons, millions of people, 500,000 people in Virginia that aren't insurable because of I think it's going to be a lot of education and a lot of understanding the message of universal health care has taken a big step. And it's taken an incredibly big step today, but it's not there yet.
We're going to, I would urge people who are viewing to go onto the website for the Legal Aid Justice Center. The website is Justice for All. Fernando, you were breaking up a little bit while you were talking, but people can really find out what all the things that you guys are doing by visiting your website. So we're running a little bit out of time here, but I would like to see, if you guys can discuss what are some of the things that men themselves can do, because it's going to take a long time before all of these disparities are taken care of at the institutional level, but there are things that men can do and start doing themselves to take better care of their health. And also, if you can tell me what kind of resources are out there so that they can do this. Ramon?
Sure. At the very basic individual level, they can, if they have an office job, they can get up and actually just walk around every 20 minutes. Sitting is one of the most, I guess, gives you a higher risk of chronic disease. So just getting out of your chair and moving around 30 minutes a day will improve your chances for that. Eating healthy, just little lifestyle things that that can really change on a cumulative magnitude. We have some resources on our website, menshealthnetwork.com or .org. I apologize. If they want to read some educational materials, there's also a lot of links to local events all across the nation. We still have another week left of Men's Health Month, so there's a lot of events still going on. We have local chapters, like I said, in all 50 states. So if there's any interest there in terms of health education and promotion outreach events, those resources are definitely available. But if at the end of the day, each man can kind of if they take more accountability in their own lifestyle and behavior, if they just take a break and walk around, they'll do themselves better. And if they can, if they have ACA, if they have insurance, whether it's from the ACA or from an existing employer insurance, go get an annual checkup and have a baseline reading of all your numbers, so that moving forward you can keep track of your progress or lack of progress, and then make some strides to improving that.
Wonderful. Jose?
Yeah, so just like Ramon said, be active, be healthy. There are some things that you can do in your day-to-day. I think from our perspective at Enroll America, it's something that take advantage of this new benefit that the ACA is. If you qualify for it, apply and then use it. We've seen that a lot of Latinos and African Americans that have gained coverage are still going to the ERs, still aren't finding out about. So we want you to use it and make use of all its benefits, and then spread the word. Let your family members know about this, because we need you healthy and we need your family healthy. And then for all those that don't qualify because of legal reasons or financial reasons, there's ways that you can get involved in the community. I'm glad that we have Fernando here to talk about some advocacy ways that you can get involved with. So there's definite opportunity in this. Like I said today with the Supreme Court ruling, the ACA is here to stay, and so now we have to make sure that we work to improve it and ensure that it's a benefit to all of those in our community, not just those that are benefiting under the current status of the law.
Nice. Fernando?
I think going off what Jose said is don't be afraid to ask questions. Don't be afraid to be vulnerable. We touched on it earlier, kind of this the classical masculinity pressures that we feel, and I think it's time to let that go. We have access to healthcare in many ways, and not only through the ACA do people get enrolled, but now there are tons of community members and community initiatives to get people that they need. Like Legal Aid Justice Center, there are plenty of places around the country that are there to support you in getting the coverage that you need. So don't be afraid to ask for help. I think that's a very negative way of treating everyone. Being afraid of being vulnerable. And I think when it comes to your health, there's no point in pride. Everyone has their health also. Not asking this question, and whether that means getting questions asking if your health insurance covers something, or getting questions about whether where I need to get a certain thing about it. All about getting information and not being afraid of it.
Wonderful. And so now, really quickly before we leave, I would like for you to say your website once again, so that people can grab their pen and write down your website so they can visit you and find out what resources you have available for them. Let's start with Fernando.
Our website is justforall.org, and there you can find all the legal help we can provide and all our advocacy and see what interests you.
Okay. So that's justice, the number 4, and the word for, ALL.
Yes, the number 4. justice, the number 4, all.org.
Awesome. And Jose?
All right, I think you said me. There's a lag in volume. So our website is getcoveredamerica.org. That's getcoveredamerica.org. We have a bunch of really cool tools. We have calculators where you can go and get your estimate for what your ACA cost would be. We also have a locator tool where you can actually go and find the nearest in-person assister that is part of your culture and speaks your language. So if you want a person that looks like you and is from your community, you can type in your zip code and pick an appointment that works for you throughout the day, and they'll follow up with you. So again, it's getcoveredamerica.org. And then again, the 1-800 number that HHS provides, 1-800-318-2596, where you can call and get assistance 24 hours a day in over 150 languages. So go and get covered.
Lots of resources in there. In Ramon.
Yes, our website is menshealthnetwork.org. It's MENS healthnetwork.org, and it's all one word. We have, like I said earlier, we have health education resources. If you want to get involved in terms of advocacy, we're definitely looking for more people to raise some awareness. And if you want to be a local champion, you can also do that. Feel free to contact one of us, and we will get you started.
Wonderful. I want to thank Fernando and Jose and Ramon for being here today. That covers it for today. We went a little over time, but the information is worth it. I want to remind everyone to please visit their website and support what they're doing, but also find out how you can get forward. Really, your health is the most important thing you can take care of. Como decimos en español, sin la salud no hay nada. Without your health, you have nothing. So I want to thank my guests again today, and I thank you for watching. I will see you next week. Have a great day, everyone. Thank you, guys.
Thank you.
Thank you.